Hello and welcome to our next episode of Live and On Call. My name is Allie with Lake Charles Memorial. I will be your host today. I'll be fielding some questions and maybe asking a few of my own questions on today's topic. It's been a little while since we've had an episode of Live and On Call, but you can find all of our past recordings on our website. There's some topics with women's health, mental health, colorectal cancer awareness, and so much more on our website at lcmh.com/video. If you would like to see any of our past episodes, if you enjoy today's episode, of course, go onto our website and you can see some other experts talking about topics that matter to you and to your family. If this is your first time joining us on Live and On Call, here's what to expect. We'll start with a discussion about today's topic, and we will then transition into Q&A. So as you're listening in and as you're hearing some of this discussion, if there's a question that sparks in your mind and you'd like to have that answered by our expert today, then we will be able to answer those questions here live. So if you want to put your questions in the comment section below, or if you would rather ask the question anonymously, that's okay too. You can message us directly and we will be able to ask that question anonymously. So before we get too far in, we have a few people joining us. So I want to get us started. And Dr. Joseph Semien is a board certified OBGYN with the Memorial Medical Group. He'll join us today. He will be live and on call to answer any questions you may have about pelvic floor dysfunction and tell us about some really great options here for treatment here in Lake Charles. So let me bring up Dr. Semien. There we go. How are you, Dr. Semien?
Good afternoon. How you doing, Allie?
I'm good. Thank you so much for joining us.
My pleasure.
Awesome. So let's go ahead and start with you introducing yourself before we break open today's topic.
Definitely. Good afternoon. I am Dr. Joseph Semien. I'm a board certified obstetrician and gynecologist here at Lake Charles Memorial in good old Lake Charles. I specialize in pelvic floor reconstruction surgery, and it's very important throughout this community, throughout the United States, throughout the world. So that'll be something that we definitely would talk about on today.
Perfect. So just a reminder for those of you listening, if you have any questions, please feel free to put them in the comments below or send us a message. But just to set the stage for today's conversation, Dr. Semien, I know many women see you as their OB to take care of them and their baby throughout their pregnancy. But there's, after those childbearing years, or maybe after when you're not ready to be pregnant anymore, what is some of the care that you can offer to women in this area?
Yes, like you said, one of the biggest things, going into as an obstetrician gynecologist, obstetric wise, is the beauty of pregnancy, is the beauty of bringing families together. However, it is actually a risk factor also, and it is mainly particular when you see those individuals that have larger babies. And what happens is over time, because the baby is large, because of multiple pregnancies, you may see something that's called pelvic prolapse. And what happens is they start to experience either pressure or they start to experience something that's called urinary incontinence or leakage from their bladder unintendedly.
Gotcha. And so is that normal? Is that a normal thing to happen for people?
That's always the biggest question because over time and many years back, everyone always felt that if you have some leakage, this is a normal, but it's not. There's no reason in today's days and time for anyone to be having some form of incontinence or experiencing something that can be debilitating to their everyday life. And there's different measures you can take, and there's different things that we can do myself surgically that can happen that can eliminate this. And I think it's important, and it's definitely something that needs to be discussed. As we look at it, about 80% of females don't even talk about incontinence and things that they're experiencing with their physician due to some form of embarrassment, or like you said, they just think that is normal.
Right. I mean, even just growing up as a female, you hear that after women have had babies or later on in life, it's you got to cross your legs when you sneeze or don't laugh too hard. And so I think as a woman, I can speak for myself that you think that that is just the part of life. And so it's good to hear that it doesn't have to be.
Yeah,
So could you
yeah.
explain a little bit how, especially with urinary incontinence, you would think that that might be a urology issue. How is that related to gynecological procedures?
Definitely. So one of the things that tend to happen, and we see so many, one of the biggest surgeries that actually happens in the United States in females is hysterectomy. And when years and years ago, what was said is that during a hysterectomy, we attack your bladder. Evidently, that was before my time, but that attacking the bladder was almost sometimes a misconception, because it's not necessarily, as time go on, it's not necessarily that just specifically your bladder that's the issue, but it's actually the surrounding vaginal walls. Um, and that's something that many women find themselves in that situation. And why? It's always good to know what's the risk factors associated with it. And like we discussed earlier, pregnancy is definitely one of those risk factors. But what you could do is generalize it in a form of saying anything that increases the abdominal pressure can be a cause of pelvic prolapse and eventually some form of urinary incontinence. So that be pregnancy, large babies, multiple pregnancies, chronic constipation, chronic diarrhea, or one thing that we see in this population is we have a large population of empowered women, so they're very independent, so they're doing more, and what you see is that because they're lifting up heavy, the first thing that tends to give is the vaginal walls. And when the vaginal wall give, this is how you get pelvic prolapse. This is how you get some form of urinary incontinence. And this can be something that needs to be addressed as soon as possible, but by different measures.
Gotcha. So, um, once someone is able to talk to their maybe their OBGYN about this discomfort or urinary incontinence, what treatment options are available? Do we run straight to surgery, or is there anything else that we can start with?
Awesome. Especially in my practice, surgery is not necessarily the first option. Um, you have to take what symptoms are they having, what's their lifestyle, what type of comorbidities we call or risk factors they have that they can even be able to tolerate the surgery, because it could be a little bit more intense, but bearable, and we'll talk about that a little bit more too. So there's other measures. I know people are pretty familiar with the term Kegel exercise, and that's when you're trying to strengthen the pelvis. That's some form of physical therapy that you can do to try to strengthen the pelvis that'll help with um, um, incontinence and so forth. And that's something that's a device, and many people struggle with this, but it's a device that you actually place in the vagina. It's called a pessary, and when you place this, it holds everything up, and then it can also aid in relieving some of that pelvic pressure, and also relief of some form of incontinence. The main one is really stress incontinence, or urge incontinence, that it really affects and helps out drastically. The interesting thing about this is, though, because it's a device, it has to be removed like every 3 months or 2 to 3 months so that it can be clean. Now, the more surgical approach, and this is where I come in, that you can take, and is very, very effective. That's something that's called after a hysterectomy, because of those organs or structures that's there, that generally holds everything up, has begun to elongate. We That's called the uterosacral ligament. We tend to do something that's called a uterosacral ligament suspension. If you already had a hysterectomy, you could potentially do something that's called a sacrospinous ligament suspension. And the gold standard is sacrocolpopexy, which can be done robotically or laparoscopically. So these are all different surgical approaches that you can do to try to eliminate those symptoms that you potentially have. Now, keep in mind that that is an approach to restructure the vaginal walls. However, when you're talking about alleviating the urinary incontinence as a whole, this is where the misconception, and this is where I actually come in at, is because you typically say go to the urologist, but that's actually part of it all. Is the vaginal wall and the relaxation of the urethra, which will all be repaired and fixed at the same time.
Gotcha. So a lot of those organs and that area is just small, and it one thing affects the other is what I'm hearing, right?
That's correct. It's
Awesome.
like a
So
combination effect, you know.
right.
Uh-huh.
So just a reminder for anybody who's watching, if you have any follow-up questions to any of this, you can go ahead and drop them in the comments or send us a message. But just feel free that this is a time to learn and to for Dr. Semien he's live here and on call for all of your questions and anything that you may need answered today. So just moving on with some of these questions. We're talking about surgery. What does a recovery look like? I know so many people, they want to get back to their lives, and surgery just sounds a little scary. What does that look like for a woman after a surgical procedure like this?
Well, when you think about it, if you're doing a hysterectomy along with this, then you recover because the main goal, which I do perform, is minimal invasive surgery. So now, when you would typically stay in the hospital longer days, the patients are leaving the next day or the same day, and the recovery is somewhere between 4 weeks to 6 weeks. Now, that's a little screwed. And the reason why is because we're talking total to that aspect of total function recovery. Now, I'm not saying by any means that if you have this surgery, you're going to be out, can't work, can't do your daily functions for 4 to 6 weeks. We tend to look at it more like if you're doing a full reconstruction of the vaginal wall along with the bladder and so forth, you're looking at about 2.5 weeks of really relaxing, really letting your body recover until you can start moving around. But the full recovery is going to take about 4 to 6 weeks or so.
Gotcha. So that doesn't mean that's gonna. I'm sure everybody recovers a little bit differently too, depending on
Most
their own
definitely. And
body.
it depends on the surgery because if you're taking urinary incontinence or stress incontinence as a whole, this requires some form of a bladder sling. And that bladder sling, you're going home, the same day, your total stay at the hospital is less than 8 hours. You're going home and you're moving on with your life within a day or two. You might have some soreness, but you're moving on.
Yeah. That's great. That a little bit of time of downtime may mean a lot when it comes to that discomfort or urinary embarrassment. That's a little bit of time for the rest of your life of comfort. That sounds
Exactly.
like a good deal to me.
Yeah, especially when you have people that's suffering for such a long time with these things. Just the aspect of, like you said, the embarrassment, the time away, just to take those couple weeks, if so, to take care of yourself and feel better about yourself is definitely worth it.
Yeah. So, what is your just kind of wrap things up? What is your best advice to women um, to prevent this pelvic floor dysfunction? Is there anything we can do?
Well, the one thing is, it's very unfortunate, but it's very common in the United States as a whole. Obesity, which means we definitely have to continue to work towards living a healthy life, diet, and exercise. The other thing is the Kegel exercise. Is one of those things that you don't have to wait till the problem occurs for you to actually continue to strengthen your pelvis. Also, if you're doing those things on those like heavy lifting, maybe a support belt would help because now you're using your back instead of your abdominal muscles. And one of the biggest things that we see so frequently is between constipation. There's so many people that suffer with chronic constipation, and it's important to get with your GI physician or your physician to really attack that as quick as possible to try to alleviate some of the things or the potential problems that can occur.
Gotcha. Yeah, I'm hearing you say that prevention is key. Doing some of those steps beforehand before it becomes a problem is really,
Mhm,
really helpful.
mhm.
So, any last words of advice to women who are struggling with these symptoms that maybe they're afraid to tell their OBGYN or tell their primary care doctor? Any words of advice?
I think the biggest thing is know that there are things out there, there are options out there that can really help you. Don't always feel that surgery is going to be the only option for you, so don't be afraid. But make sure you discuss with your physician the issues that you're having. It's very common. You're not alone, and there are people out there that can help you. And definitely, if desire, then I can definitely assist you with that.
Perfect. And I'm putting up on the screen the phone number to Dr. Semien's office. If you would like to make an appointment with Dr. Semien, I'm sure he'd love to see you. His office is located adjacent to the Memorial Hospital for Women out on the Goche Road. So, well, Dr. Semien, I really appreciate you taking the time to share this advice and this expertise with us. It's really helpful to have someone who understands what women are going through and are willing to help fix issues. So thank you so much for that.
You're welcome. My pleasure.
All right. I think that I'm looking at our comment section. If anybody has any comments or any questions, you can go ahead and put them in now. But it looks like we don't have any questions in the comment section. But if
I
we
think
do get any, go ahead.
I think they will come later.
Yeah,
It's too typical, like we said before. Um, this is a very trying conversation for many women, and so just know that we will be here, and if you need some assistance or anything, that we're definitely able and willing to take care of you.
great. And if we get any messages or comments after the fact, I will go ahead and send them over to you, Dr. Semien, and have them answered if that's okay with you.
That's perfect. Thank you. I appreciate it.
All righty. Well, everybody have a great Friday, and we will be back next month with another topic and another expert live on call to answer any questions. So thanks again, Dr. Semien, and y'all, everybody have a great weekend.
Have a good afternoon, Allie.